So, no, I wouldn't say I have a passion for HR.
Welcome back to Human Resources for the People. It's a human capital revolution. Depending on a lot of different factors, there may be raises coming to healthcare workers in California. I think this is interesting. Statewide minimum wage has been established for healthcare workers. It'll be phased in over time. This was signed on October 13th. It's Senate Bill 525, which creates a multi-tiered statewide minimum wage schedule. And that's what's interesting about the schedule is that it's not just a flat minimum wage across the board. It has 5 different minimum wage schedules depending on the nature of the employer, which sounds a little weird to me because if it's a minimum wage that people deserve, why not all? And that's because minimum wages can ultimately kill business and make them, untenable and unworkable, right? That's why it's not all, but that's also very frustrating because the selective style of lawmaking results in, frankly, some really bad laws. And you saw that kind of with the fast food minimum wage. You have a fast food minimum wage that only applies to chain restaurants with 60 or more restaurants within the chain. And there's no rhyme or reason. Chain restaurant employees are not inherently better than regular restaurant employees. And ultimately, what you see here is the result of lobbying and union interference, and specifically surrounding the healthcare as well as fast food. I mean, these are two very powerful unions in California, SEIU and UFCW, uh, which is the United Food and Commercial Workers. And the SEIU is the Service Employees International. But there is quite a few interesting things that have come from it. There's a comprehensive minimum wage schedule based on covered healthcare employees. There's all sorts of different ways that the facility might be classified, and ultimately it's determined by size, type, location, and governmental payer mix, which I find that to be the most insightful. So what they're classifying as a high governmental payer mix is a licensed acute care hospital where the combined Medicare and Medi-Cal payer mix is 90% or greater. And the government, who is paying and footing the bill for this, has decided that they don't actually need that much money. Minimum wage for hospitals with a high governmental payer mix or rural independent covered healthcare facility, they don't actually need to attract the top talent. They can make $18 per hour beginning on June 1st, 2024. Why that is, well, of course, it's simple economics. This could absolutely destroy these facilities who already operate on pretty thin margins. But, ultimately, I would argue that because the intention behind this law is to attract healthcare workers to the state, and rural hospitals are some of the worst hit. It's very difficult to get healthcare workers out to these rural hospitals. And as a result, they would need them most of all. The problem is that ultimately it would put them out of business. It's untenable until it's not, right? Rather, it's tenable until it's not. This has a broad array of different positions as a covered healthcare employee, like, of course, nurses and physicians to support positions such as janitors and clerical workers, and of course, extends to subcontracted workers where the healthcare facility has control. It excludes salespersons, public sector employees, et cetera, et cetera. The basics. The minimum wage for large employers is from 2024 to 2025 is going to be $23 an hour. And of course, they can absorb this. And this, I imagine, will exacerbate the staffing of the lower paid minimum wage jobs, right? Because people will go from the hospitals with high government payer mix and rural independent facilities to these large employers who have a higher minimum wage. And so it's really frustrating because this will prove to be, I think, self-destructive for these rural systems, and the level of care will get worse. The hospitals with high government payer mixes, rural independent facilities, or county-run facilities in low population counties will go to $18 an hour in 2024, and then up to May 31st of 2033 with 3.5% automatic increases annually. Then primary care, free community and rural clinics, they're going to move up to $21 an hour as a minimum wage from 2020 June 1st, 2024 until May 31st, 2026, and it will escalate from there. So, what do you think? I mean, this comes on the heels again of $20 minimum wage among fast food workers. So, the minimum wage for fast food workers is higher than the minimum wage for hospitals with high government payer mixes. This seems to likely exacerbate some of the problems that California has with healthcare, and specifically in the rural counties. Having lived near some rural counties of California, it gets quite dire out there trying to get healthcare in these rural communities, and this seems to make it even worse. But what do you think about this new minimum wage scale in California? Do you think it will be successful, or will there be trouble brewing on the horizon? Let me know in the comments down below. Like, share, and subscribe, and we'll see you on the next video. Bye, guys.